Ovarian cancer is a type of cancer that originates in the ovaries, which are the female reproductive glands responsible for producing eggs, and hormones such as estrogen and progesterone. Ovarian cancer is often called a silent killer because its symptoms can be vague and easily attributed to other conditions, making early detection challenging. Types of ovarian cancer. Ovarian cancer can be categorized into several types based on the cells from which it develops. Epithelial ovarian cancer. Serous, the most common subtype, typically arising from the surface cells of the ovaries. Mucinous, often characterized by the production of mucus. Endometrioid, associated with endometriosis. Clear cell, less common and often associated with a poorer prognosis. Germ cell tumors. These tumors develop from the cells that produce eggs and are more common in younger women. Stromal tumors. These tumors arise from connective tissue cells that hold the ovaries together and produce hormones. Risk factors. Several factors may increase the risk of developing ovarian cancer. Age. The risk increases with age, especially for women over 50. Family history. The family history of ovarian, breast, or colon cancer can increase risk due to inherited genetic mutations, such as BRCA1 and BRCA2. Genetic mutations. Inherited mutations in genes such as BRCA1, BRCA2, and Lynch syndrome-related genes can significantly increase the risk. Personal history. Women who have had breast cancer or endometriosis may have a higher risk. Reproductive history. Factors such as having children later in life, not having children, or having irregular menstrual cycles can influence risk. Hormone replacement therapy. Long-term use of hormone replacement therapy after menopause has been associated with a higher risk. Obesity. Being overweight or obese is a known risk factor for various types of cancer, including ovarian cancer. Symptoms. Symptoms of ovarian cancer can be nonspecific, which often leads to late diagnosis. Common symptoms may include abdominal bloating, the feeling of fullness or swelling in the abdomen, pelvic pain, discomfort in the pelvis that may come and go or persist, changes in urination, increased urgency or frequency of urination, changes in bowel habits, constipation or diarrhea, unexplained weight loss, significant weight loss without a clear reason, fatigue, persistent tiredness that does not improve with rest, difficulty eating, feeling full quickly when eating. Diagnosis. Diagnosing ovarian cancer typically involves a combination of methods. Medical history and physical examination. Healthcare provider will review symptoms and conduct a pelvic exam to assess for any abnormalities. Imaging tests. Ultrasound, often the first imaging test used to evaluate ovarian masses. CT scan or MRI, provides detailed images to assess the extent of disease and help determine treatment options. Blood tests. CA-125 test measures the level of the CA-125 protein, which may be elevated in women with ovarian cancer. However, elevated levels can also occur in other conditions. Biopsy. The definitive diagnosis is made through a biopsy, where a sample of the tumor is examined microscopically to confirm cancer presence. Laparoscopy. In some cases, the minimally invasive surgical procedure may be performed to obtain tissue samples and visualize the ovaries and surrounding structures. Staging. Ovarian cancer is staged using the FIGO system, which categorizes the cancer based on its extent. Stage I. Cancer is confined to one or both ovaries. Stage II. Cancer has spread to the pelvic region but not beyond. Stage III. Cancer has spread to the abdomen or nearby lymph nodes. Stage IV. Cancer has metastasized to distant organs, such as the liver or lungs. Treatment. Treatment for ovarian cancer usually involves a combination of surgery and chemotherapy, depending on the stage and type of cancer. Surgery. Debulking surgery. The primary treatment, involving the removal of the ovaries, fallopian tubes, uterus, and surrounding tissue. The goal is to remove as much tumor as possible. Staging surgery. may be performed to determine the extent of the disease. Chemotherapy, often administered after surgery to kill any remaining cancer cells and reduce the risk of recurrence. Common regimens include combinations of carboplatin and paclitaxel. Targeted therapy, PARP inhibitors, such as olaparib and niraparib, which target cancer cells with specific genetic mutations, e.g., BRCA mutations. Monoclonal antibodies, such as bevacizumab, may be used in certain cases. Radiation therapy, rarely used for ovarian cancer but may be considered in specific situations, such as palliative care to relieve symptoms. Prognosis. The prognosis for ovarian cancer varies based on several factors. Stage at diagnosis. Early stage diagnosis generally has a better prognosis compared to advanced stage cancer. Response to treatment. How well the cancer responds to initial treatment can influence long-term outcomes. Histologic type. Certain subtypes of ovarian cancer, such as clear cell and mucinous, may have different prognoses compared to serous tumors. Overall, the 5-year survival rate for ovarian cancer is approximately 49%, but this rate significantly improves for early-stage diagnoses. Follow-up care. Regular follow-up care is essential after treatment to monitor for recurrence and manage any long-term side effects of treatment. Follow-up may include regular physical examinations, imaging studies as needed, blood tests for tumor markers like CA-125. Conclusion. Ovarian cancer is a serious and often challenging condition due to its vague symptoms and potential for late diagnosis. Understanding the risk factors, symptoms, and treatment options is crucial for women and healthcare providers. Early detection through awareness and regular medical check-ups can significantly impact outcomes. Ongoing research into new treatments and supportive care continues to offer hope for improving survival rates and quality of life for those affected by ovarian cancer.